Welcome everyone to our third CNS Summit community call on navigating the COVID crisis. Thank you for participating today. I hope it will be a good end to a week, although most of us are probably working 7 days a week, but at least the Friday, we can end the Friday on some interesting presentations. As usual, we have a great lineup of short presentations, most of them really using data to shed light on what's been going on in our ecosystem. And I'll talk a little bit more about that in a minute in terms of what we're having for today. As a reminder, for our May 8th call, Dr. Amy Abernethy, Principal Deputy Commissioner of FDA, and as you remember, a CNS Summit 2019 speaker, has kindly agreed to answer questions for us regarding the COVID-19 crisis, the FDA guidance around that. Amy has been very active in leading the FDA response, and this is really a great opportunity for all of us to interact with her. The Secretariat has sent out an email earlier this week asking you to submit any questions you have for Amy. If you have not done so, please, as soon as possible, send an email to secretariat@cnssummit.org with the question that you have for Amy, FDA. I think, there's a whole range of things we can ask us. I would ask that if you're interested, please submit those questions. We do have to get those to the FDA early so they can review it, so that'll be very helpful. Today, we're going to again have some new speakers looking at different aspects of what's going on in the current crisis. Previously, as you know, we've looked at enrollment rates with data, adherence rates with patients in terms of medication. We've looked at different ways of adapting outcome measures in the community. So today I wanted to kind of have a different view of what's going on. And I'm happy to have a series of speakers, many of which are really also focusing on the patient perspective at this time. So in a minute, we will kick off with Luke Kramer, who's Executive Director of the STARR Coalition. And he's going to talk about all the different inputs he's had of the entities that STARR deals with and what they think is going on and what they're hearing. Then we have Ivor Clark, who's CEO of SubjectWell, who's been doing some interesting surveys of patients and their attitude towards willingness to be in clinical trials. So we're going to cover that. Then Jeff Wendell, a President and COO of Advara RRB, is going to go over some of the common things they've been addressing from sites and other entities who want RRB guidance and some resources for people who want more information. Then we have Dr. Gary Zamet, President and CEO of Clean Labs, talking about how his entity has been really understanding what's going on, some data for us in terms of what they're seeing. And then we're going to do some fun stuff towards the end to help round out the week. So with that, if I may hand over the microphone to Luke Kramer from the STARR Coalition to kick us off about some of the things that I've been talking to Luke about in terms of what they've been hearing. So Luke, please go ahead.
Thank you, Amir, and hello, everyone. I hope everyone is healthy and safe during this very unusual time. But as many of you know, the STARR Coalition, we're a nonprofit organization, and we're really driven by you guys, leaders within the CNS community, to help find innovative ways to bridge the gap between the industry, advocacy, treatment providers, and communities, as we really work focused on promoting more cutting-edge research for brain disorders. Can I have the first slide, please? Thank you. Everything I'm going to talk about today is really direct feedback from our stakeholders. Although we're working in many areas of CNS, I'm going to focus today primarily on mental health. First, the site feedback. So the responses to this crisis have really been all over the map. Some sites are thriving, others are frozen, and others are simply saying, you know what, it's been a good run, but we are out of this. So we have to be aware that this has not been a one-size-fits-all model, but we have seen some very exciting trends from many sites. For the first time, some are even establishing themselves as really a part of that healthcare ecosystem. So sometimes they're sharing personal protective equipment and physical resources with maybe local clinics or mental health facilities. They're working with local healthcare officials to open up the use of inpatient beds. We have some that are actually providing COVID testing for subjects and even the community. We're seeing an increase, obviously, in remote visits, face-to-face visits right in the community. But we're seeing some really great work from sites relieving the burden that many of the community has with their needs. For instance, at the CNS Summit this year, we actually launched a project, the STARR Site Certification. And many of you helped create this certification, and we certify sites in the areas of community integration and assessing strengths and working with advocacy and suicide prevention and more. So we're assisting a lot of these certified sites and others to recognize all these opportunities that exist out there and share these ideas so we can all really excel during this unprecedented time. Some patient perspectives. You guys are going to hear a lot about this today, and some of the other speakers have some incredible data, but what we're finding is the message is very consistent. We are hearing from stakeholders that patients and subjects are wanting to remain in trials. For many individuals, and especially those living with mental illness or serious mental illness, many times they see research as that lifeline. They rely on those routine health screenings, having access to experts on their condition. They built trust a lot of times with the site staff. And many are stating they just appreciate that human contact. I think even Dr. Walling mentioned last week of seeing an uptick of referrals. And I think that we're seeing a lot of sites that are actually echoing his words. But one concern that has been coming up is the digital divide, and mostly those that are living with serious mental illness. They don't always have the economic means to have access to technology or even experience with technology or even internet connectivity for some, really to kind of stay lockstep with this shift to virtual trials. I talked with one treatment facility who had to purchase over 100 iPads and share them with all their clients, work with service providers to make sure they had internet access, and do all this to set in place just to begin the process of remote treatment and assessment. So the overall lesson is we believe that sites are going to continue to need help with this. Have the next slide, please. Thank you. So advocacy. I talked with Paul Gianfrido, he's the CEO of Mental Health America last week, and he said that they have seen a dramatic increase in online mental health screenings. Also seeing the severe increase in the severity of some of the symptoms. For instance, a lot of people that may be considered kind of a walking worried are now transitioning into having full-blown clinical anxiety. It seems like, and I'm sure all of us are a part of this, they're really taking stock of their mental health as they never have before. A leader at NAMI actually reiterated this by saying it is a profoundly disruptive time for advocacy. NAMI in particular said that some of the affiliates are seeing a 300% increase in the volume of calls they are getting requesting assistance from the community. They too, though, are also moving to try to do virtual meetings for education and support. But all of this transition that's happening with advocacy is happening while they're seeing huge losses in revenue. Spring is generally an important time for many advocacy organizations for fundraising, but they're seeing sponsors pulling back, and advocacy is losing revenue in the midst of this increase for service demand, which I think that we need in research to see this as an opportunity to step up and support advocacy. Again, we're here, the STARR is here to assist any of you who may be interested in making those connections, especially through our certification process. And Paul actually had a really interesting thought about comparing this pandemic and the mental health surge. He said that he predicted as the curve begins to flatten, that mental health is in the eye of a hurricane, and the storm is not over. And in short order, that eye is going to pass, and we are going to be hit by the heaviest winds, right? More than ever, people are going to be looking for options. And we in research need to be on the front lines of that storm to ensure that each individual who has that milieu of options laid in front of them when they're seeking some type of help, that research is on the table. So this is a great opportunity for us to really work with advocacy and move forward. I'll conclude real quick by saying that, you know, mental health happens to be kind of this golden thread that's running through a lot of conversations around this pandemic. We have a wealth of resources. You guys can go and visit our website at www.thestarr.org. For instance, next month is Mental Health Awareness Month. So we've worked with some of you guys to create dozens and dozens of social media posts that you guys can grab, you can share, but it's really all focused around the importance of mental health research. But they're all there for you guys to use however you would like, but you know, if you get a chance, please hashtag the STARR Coalition. You can also go to our website and check out the Research Response tab at the top. So we have compiled a lot of stories about how research is contributing to solutions right now. You can listen to interviews with a lot of thought leaders, read about success stories happening at the site level, ways really that COVID-19 is impacting patient enrollment, and much, much more. And for the sites that are here today, next week we're finalizing a webinar series for sites, led by sites, for you guys to come together and really share how you're adapting to these times, and hopefully learn from one another and take that with you as you go forward. Also find out about our STARR site certification. So this is really a great foundation for all of us to work collectively to really enhance the work that we're doing and to promote CNS research from our local communities to throughout the globe. So those are some of the things we're getting back from our stakeholders. If you guys have questions, please post them. I'm sure that we'll get back to them soon, but thank you again, Amir, for the opportunity to speak. And really on behalf of so many people that are depending on more research, thank you guys for continuing all the hard work. I know this is a big transitional period for all of us, but we are finding either the new normal, but maybe a better normal. But I appreciate all the work you guys are doing. Thank you, Amir.
And thank you, Luke, for everything you and the STARR Coalition is doing. So, you bring up a great point that I think hasn't been spoken enough yet, which is a tsunami of mental health issues that are coming. I think not only will it affect our patients, it will affect all our first responders, all people in healthcare, everyone in society, really. But I think that's a whole huge topic that we, as we go forward, we will have to sort of think about more, in terms of research, but really even in terms of people in the infrastructure of research. So I think it's a very important topic, and I'm glad to kick off with an advocacy group. Thank you, Luke, again.